for joining us for this all-important Policy Advocacy Roundtable as we are commemorating International Safe Abortion Day 2024. And we'd like to extend a special welcome to our esteemed panelists who are representing policymakers as well as leaders working within the religious sector and a representative of adolescent girls and young women themselves. So this is the SAfAIDS Regional #SupportChoice Commitment to Action Policy Advocacy Roundtable under the theme Bold and United for Health Justice, upholding the rights of adolescent girls and young women through expanding access to safe and legal abortion in the SADC region. And our theme today is a very important one, and this discussion is more critical than ever, especially on International Safe Abortion Day, where we are trying to bring to the fore some of the bold actions and united efforts that have made way for progressive actions within our region, but also reflect on the continued existence of restrictive laws and as well as stigma and discrimination, especially when it comes to access to safe abortion care for adolescent girls and young women in the SADC region. So today we are going to be hearing from the different experts that we have with us, as well as exploring some of the responses that they have been involved in within their respective sectors, but also looking at how then do we come together, being bold and united for action to ensure that we catalyze some of the policy advocacy actions towards addressing unsafe abortion with regards to the policy environment within the region. We are joined today by Honorable Regina Esperon, who's the chairperson of the SADC Parliamentary Forum's Regional Women's Parliamentary Caucus. We're also joined by Honorable Dr. Matthew Zungwale, who's the chairperson of the Parliamentary Portfolio Committee on Health from Malawi, as well as Ms. Bonginkosi Moyo Bango, who's the Regional Communications Director of the Methodist Church in Southern Africa. And lastly, we're joined by Tina Vante Lungu, who was a young woman leader and an advocate who was part of the SRHR Regional Youth Advocacy and Accountability Alliance from Zambia. So I'll open up to my panelists and ask them to introduce themselves briefly, starting with Honorable Esperon, before we move on to the discussions. Thank you.
Good afternoon, ladies and gentlemen. I'm Honorable Esperon, Member of Parliament from Seychelles, and also the outgoing chairperson of the SADC PF Women's Caucus. Presently, I'm still a member of the Women's Caucus, and I'm also a member of the Gender Equality and Youth Caucus for the SADC PF.
Thank you very much, Honorable Esperon, and welcome. Honorable Dr. Ngwale, please. Thank you.
Yeah, thank you so much. Good afternoon. My name is Matthew Zungwale. I'm the chairperson of the Health Committee of Parliament in Malawi. Basically, that's it.
Thank you very much, Honorable Dr. Ngwale. And I'll move on to Ms. Bonginkosi. Thank you.
Thank you, Shemaine, and thank you to all the listeners and participants in this very important conversation. My name is Bongi Moyobango. As already has been said, I'm the Communications Director for the Methodist Church of Southern Africa, but I'm also an SRHR advocate and researcher, and I'm very passionate about young people, especially young women and girls. Thank you.
As Shemaine already said, my name is Tina Vante Lungu. I'm a Youth Advocacy and Accountability Alliance member from Zambia, as well as sexual reproductive health and rights advocate. Thank you.
Thank you very much once again to our esteemed panelists. And then moving on straight into the discussion, I'll start with you, Honorable Esperon. How can we harness the role of women's parliamentary caucuses in advocating for legal reforms to expand access to safe abortion, especially for adolescent girls and young women in the SADC region?
what do we have to do as women parliamentarians? There is a need to sensitize each and every woman parliamentarians, because the problem is you can have a group of women in parliament with different ideology, and not everyone would believe that we have to have laws to protect young girls and young women to be able to access free health and safe abortion. This is the hurdle that we face when trying to push for safe abortion. It's not everybody that has the same thinking about the needs for young girls.
That's very noted, Honorable Esperon. Thank you very much for that. But in your role as a woman parliamentarian, then what other strategies have you been able to apply in trying to build the capacity as well as sensitize fellow parliamentarians, particularly fellow women parliamentarians, in Seychelles as well as in the region?
We brought a motion to the table for discussion for the Ministry of Health to be able to change the policy of access to contraceptive and to health care for the young woman. Because right now we are faced with the situation that I think maybe other African countries are facing, where a young girl cannot access contraceptive freely in the health center without having the mother's consent. But we brought a motion to the table to discuss so that we could change that policy to allow young girls to access to contraceptives.
Thank you very much for sharing that. The experiences from Seychelles with a positive outcome where there's a unanimous agreement amongst the parliamentarians. And speaking of parliamentarians coming together for collective actions, I'm going to turn to you, Honorable Dr. Ngwale, just looking at your experiences in Malawi, especially around leveraging parliamentary committees to drive the national health policy reforms for access to safe abortion, as well as strategically countering opposition. And I'd like for you to share some of your experiences as well as the strategies that you've been able to apply. Thank you.
Thank you so much, Charmaine. Indeed, as you know, Malawi is one of the countries with the most restrictive laws regarding abortion. And therefore, most MPs were negative about abortion. The whole country, maybe even in the rural areas, people don't approve of abortion at all. And therefore, it has been a very, very difficult situation. What was happening in Malawi is that the civil society was coming to parliament to persuade members of parliament to change the laws. And most members of parliament were very resistant because they were afraid of the religious leaders in their constituencies. They were afraid of traditional leaders in their constituencies. As a result, this process has happened for several years where civil society or NGOs have been coming to parliament to persuade, and nothing has been happening as the years have gone by. But this past 2-3 years, what we did was when we made an effort to bring the motion to parliament to change the laws, the whole nation was shaken, even the president was involved. So everybody was sensitized about it, and people started discussing. What we told the civil society as parliament and all the NGOs involved, we told them that, look here, the biggest problem we have is that rural people do not know anything about abortion, such that even when a girl dies of abortion in the rural areas, the village doesn't know. they think it's witchcraft or something like that. Therefore, the subject, abortion, is not known. And therefore, there's need for civic education first, as a first step. We need to be on radios, we need to be on in newspapers and TV discussing the issue of abortion so that each and every person in Malawi is aware of the existence of the problem. And therefore, we said that until when that happens, until when we see substantial communication in the media, please maybe suspend coming to Parliament to ask members to change the laws. Because the laws of a country are not changed by civil society. They are not even changed by members of Parliament. The laws of a country are changed by the people of the country. So it's the people that have to be sensitized. It's the people that will demand the change. We as members of Parliament are just carriers of the people's will. So after that, you can come. So from 2021, civil society and the NGOs have been on going into our constituencies, running groups of women, groups of youths, having focus group discussions, and people having talks to try and make this subject talkable. They've invited members of Parliament in the areas as well to participate in these sessions. And nationally, they've also called key people in the fight for abortion to participate in these sessions in different places in the main cities. So there's been some progress, I can tell you that, in the sense that now, I used to be abused and insulted at Parliament. It's no longer the case. People now actually respect that I was able to see something way ahead of them, and that they're asking me, when are you bringing the bill? I think it can pass. So there's a positive attitude towards that. Only 2 days ago, we were invited to participate in a workshop. And in that workshop, several members of Parliament from different committees were invited to that workshop. I was so pleased to see several members of Parliament talking positively about the abortion issue, whilst in the past they would not even have come to that meeting. So there's a lot happening. I'm just encouraging the civil society and NGOs to continue with the media, because it is not saturated yet, the media. We need to still continue talking about it. Very shortly, I'm sure, unfortunately, we have an election coming very shortly in 2025. And therefore, this is a sensitive time for us to be talking sensitive issues. But I'm sure that come next year, when we have our elections, this issue brought to Parliament will pass.
Thank you very much, Honorable Dr. Ngwale, for sharing those experiences from Malawi and also just highlighting to us, the positive change that we can have with collective collaborative actions, especially around sensitization and capacity strengthening to build the critical mass that is needed, for the support to ensure that the policy reforms are actually passed. I'm going to come to you now, Wongi. There's something that Honorable Dr. Ngwale raised, especially around opposition coming in from the religious setting or the religious leaders sector. And I would like to find out from you, Wongi, how then can we harness faith-based communication platforms for sexual and reproductive health and rights advocacy, especially advocacy around safe abortion, for example, and when we're trying to address stigma surrounding issues to do with abortion, especially when it comes to adolescent girls and young women?
Thank you very much, Charmaine. It's not an easy road, despite the fact that faith-based organizations and churches in particular have had a long history of providing guidance, support, and leadership within communities, particularly in issues and areas of social and moral significance. When it comes to issues such as sexual and reproductive health and rights, including any talk about the termination of pregnancies, FBOs and churches often struggle to navigate the tension between religious beliefs, teaching, and the health needs of their communities. And in most cases, as you would know, what tends to win will be definitely the religious beliefs. And this tension at times contributes to the stigma that surrounds access to a range of SRHR services, to the stigma that surrounds even talking about SRHR issues, leaving many young women in a vulnerable position. So when we talk about the platforms that faith-based organizations have, we often start with the pulpit because that's probably the most prominent. But they also have newsletters, radio programs, social media, and these have a huge potential for shaping public opinion and promoting critical health interventions. They offer a unique opportunity to foster conversations that address stigma and misinformation around SRHR issues. So in case of safe termination, I was saying, they can serve as spaces for engagement that promote understanding, compassion, and informed decision-making. Because of the privacy that a lot of young people associate with social media in particular, we may find that they would be more comfortable engaging over social media platforms once they feel that that is a safe space. By leveraging these communication platforms, FBOs can encourage dialogue that challenges harmful norms and addresses the reality that many adolescent girls and young women face: unwanted or unplanned pregnancies. Faith leaders are key influencers, and their involvement in addressing this complex, the complex realities of SRHR is crucial for creating environments where women can access care without fear of shame or condemnation. So in terms of addressing stigma, faith-based organizations can do this through faith-informed messaging. And one of the primary barriers to comprehensive sexuality, sexual and reproductive health and rights access is the stigma that is perpetuated by misconceptions and cultural taboos that are often reinforced by religious beliefs. A faith-based communication approach that is grounded in compassion and care for vulnerable populations can help to reduce the stigma. And I'll mention one or two strategies that we could use. And the first one would be to educate faith leaders, to equip them with accurate information about the health risks that surround unsafe terminations and the legal frameworks within their particular borders, because this will equip them and enable them to provide guidance that aligns with both public health imperatives and the moral and ethical values of their faith communities. The second one would be promoting dignity and care, to frame messages that focus on the dignity and well-being of adolescent girls and young women, emphasizing their right to make informed decisions about their bodies, can help to reframe the narrative around all aspects of SRHR. So drawing on religious teachings about care, compassion, and justice can provide a moral foundation for this kind of advocacy. I could mention several more, Charmaine, but I'll stop there for now.
Thank you very much, Ibongi, for your submissions and actually going even further to share with us specific, strategies or approaches that could be taken, especially when engaging within religious leaders or within with faith-based organizations within our region. And I'll turn to Chinavante, because Bongi mentioned, for example, the issue of social media and young people using different strategies. And I want to hear from you, Chinavante, as a young woman leader yourself. How do we ensure that we have youth-led advocacy for safe abortion rights, actually empowering adolescent girls and young women through youth organizing and movements to ensure that they're able to exercise their agency?
Thank you so much. I mean, I think the best way would be to actually get young people on board and have them in these very platforms where they can actually speak out about issues that they are facing, as well as how they can, improve these issues around them. So another thing would be, as Demoki mentioned, using social media to educate. So it's one way to educate when young people understand that there's need to learn about certain things. I know a lot of us young people right now would talk about being sexual reproductive health rights activists, but not so keen about talking about the safe abortion policies, as well as just safe abortion in general. So that means that it's important that even as we get onto these platforms as young people, we also get to learn and be aware of some of these issues that affect adolescent girls and young women. So it's important that we're on top of what's happening when it comes to comprehensive sexual education. We are aware about, we're in these seminars and in these workshops, as well as we ourselves forming advocacy groups that, would not only educate our fellow young people about about the policies, but as well as get to know our rights and also get to understand the available resources and information that we have at our fingertips, as well as get into these very communities where these issues are happening. That's very key, because that way we understand exactly what it is we want to advocate about as young people. And another thing that I would mention is, when we get into this platform, another challenge that young people face is access to resources. So you'd be in a certain platform, but you can't access certain resources because of maybe mostly your age. And another thing, maybe not understanding exactly what those policies, as well as the resources they are going to get. So I think having young people be distributed resources that would help them, advocate for the cause. This means going into our communities and educating young people about, safe abortion. In Zambia, we have the Termination of Pregnancy Act, which was revised in 2019. However, we have changes now that have been made, and instead of getting 3 physical signatures, now you can go for 2 electronic signatures, which is good, because that was the power of social media. But at the same time, not all young people have access to the internet or social media itself. So we need to understand and obviously they're still aware that you need 3 signatures, but when we go into these platforms and raising awareness and talking about exactly some of the changes that have been made to certain policies, that way we understand that we use our creativities to address issues that affect us, in this case issues of access to products and services such as safe abortion or even contraceptives.
Thank you very much, Chinavante, for sharing that experience, and also just sharing some of the successes coming out of Zambia as well. Honorable Dr. Ngwale, I'll come back to you. You're just sharing with us what has been happening in Malawi and the progress that you've made so far. And we've seen in recent years, the rise of the anti-rights movement, the anti-gender movement. So how then do we ensure that, you know, we still remain unified, we still remain working together, but ensure that we are strategically countering the anti-rights movement to ensure that those advocacy gains that have been made are not lost.
Yeah, the religious community in Malawi is very, very organized. I think the several churches have formed a body with the structures, they've got spokespersons. And one of the issues they pay attention to is the issue of abortion. They are so determined that it shouldn't be discussed in parliament. And therefore, they monitor the media a lot. And whenever parliament is about to meet, normally they even come with false information that, no, this session, they're going to discuss the abortion. Please don't do it, when actually that is not the case. So we together with the civil society, we have been meeting, we hold meetings, we invite actually, we are trying to recruit several religious leaders, and we are winning on that front. So there are several religious leaders that are very committed to the issue. They also quote the Bible and the Quran, where it talks positively about issues of abortion. I think that involvement is helping to strengthen us as well. And by having them in our team, we're beginning to have different portfolios within which can talk about the demand for abortion laws to be changed in Malawi. The other thing also, the other thing where the common factor for all this in Malawi is the fact that we are using statistics. There's lots of deaths per district for women. And also there's lots of data on complications on abortion per district for each and every district in Malawi. All those are very, very high and very alarming, very concerning for everyone. And whenever we meet, when we talk about it, that should we turn our back on this problem because of issues of religion or because of issues of culture, we agree, all of us, that we need to do something. So we have a common front there, but maybe what to do is where the differences are. But as I said, we are gaining in terms of I've seen new religious leaders attending meetings of late, which is very, very positive.
Thank you very much, Honorable Ngwale. Honorable Esperon, I see your hand is raised. I was actually going to come to you now. And I would also like, as you give your submission, to also respond. How then, we're hearing about what's happening in Malawi. We've also just heard from Tinavante what's happening in Zambia as well. And you're also sharing your experiences from Seychelles. So how do we ensure then that we have platforms, you know, especially for parliamentarians, to bring all of these best practices or models and approaches that have worked? How do we bring them together so that the lessons are shared across the region and we actually inspire the other member states to take up action?
Thank you, Charmaine. I've raised my hand. What I wanted to say, that the national health policy in Seychelles right now is being revised. And SRHR is one component within the policy. What I wanted to point out that if we don't have the political will, we will go nowhere. Where there is political will, we'll be able to see the light at the end of the tunnel. Why I'm saying this is because we can have policies, but we have to turn those policies into laws. If policies are not turned into laws, it's not that binding. See? And there are a lot of policies that cause barrier to healthcare providers. If we have political will, the government will turn that policy into a bill and bring it to Parliament for us to have a debate and approve it into a law. This is the only way that we would be able to move forward. I respect, Bonnie, what you say, educate faith-based leaders and then promote dignity of care. Yes, we can do that, but still, if we don't have tangible laws to be able to protect our young girls and young women, we would be how would you say, we would be finding resistance, and always we would be dealing with the opposition.
Thank you very much for sharing that, Honorable Esron. I think that's very critical. So we need the political will, but we also need to catalyze the actions of turning policies into actual laws and bills. Whether it's the lessons from Zambia or the lessons from Malawi that we can package to use for advocacy to ensure that the policies are turned into actual laws that are binding. And I'll come back to you, Bongi, now. We've been talking about, and you notice that the issue of the religious sector keeps coming back again. So I'd like to find out from you, Bongi, what language or messaging is the most appropriate to use, that as shrouded within the rights-based approach, but also takes into consideration that we don't want it to be a morality debate. More than anything else, we want the discussions to be around public health, the urgent need and the lived realities of adolescent girls and young men. So what sort of language and messaging then would be most appropriate within the religious sector, or when we're trying to engage with the religious sector?
Thank you, Charmaine. In as much as we would want to keep this conversation within the human rights framework, sometimes that doesn't work with the religious sector. And the language that tends to work is a language around common values, a language around human dignity. So when we focus our conversations around the dignity of young girls, the dignity of young women, and life as a value, then you're speaking a language that religious entities can identify with, because they preach life, they preach love, they preach compassion. So a language of compassion, which is why it's so important to tell the stories. I like what Honorable Esperon said just now about the stats. I think Dr. Matthews mentioned the stats as well. The importance of sharing the statistics, but beyond just sharing statistics, tell the stories. The language of lived experience speaks louder to religious entities than just bare data. Data for them might not have as much life as a testimony. That's why we have words like testimony. So the story of lived experience, a young 15-year-old adolescent telling her story would move religious communities to action, because now all of a sudden the issue has a face. So it's the language of humanizing the issue, because sometimes cold hard facts divorce from the human face. They're divorced from the human face. So humanize the issue, tell the lived realities, the stories, and then you can shift the thinking and the narrative within the spaces, religious spaces. Thank you, Charmaine.
Thank you very much, Bongi, for emphasizing that. And I like that you emphasize the dignity. So putting at the forefront or at the core of our responses, of our discussions, of our deliberations, safeguarding the dignity of adolescent girls and young women. I'll come to you now, Tinavante. I want to hear from you. So what sort of support would be adequate or is needed for adolescent girls and young women, whether from the religious sector, from policymakers, from civil society, from the media and other sectors as well? What sort of support is needed to ensure that adolescent girls and young women actually are able to exercise their agency. They're able to access information related to sexual and reproductive health and rights, including safe abortion, as well as access services should they need the services.
Thank you, Charmaine. I think the major one would be skills building, skills training. So they need to offer, training in leadership as well as advocacy itself, and also public speaking, and the need to just be effective leaders, beginning with our personal lives and then, spiraling out into the community. And also, there's also need for us as young people to have a very good partnership with health providers, because we know when we're going to access some of these services in these health centers, if the partnership that young people have with these health providers isn't good, it means it limits the kind of services they get from these service providers. And I think another one, which is sort of also a little bit of a challenge, is the same resource distribution, because would have these commodities in our health facilities, but they're not evenly distributed. So some young people are able to access certain services in certain areas, but can't access certain services when they move to different areas. So I think having evenly distributions of these resources, having to have enough platforms that offer, skills training, and these skills can also be like soft skills when it comes to how to, work the internet, to avoid a lot of misinformation that happens among young people, and just having a lot of platforms and opportunities that young people can belong to, like different CSOs, different movements that would enable them, not only have people speak for them, but have them speak for themselves in these platforms. So that would also work, as well as think having supportive legislature that young people actually put effort in and, take part when creating some of these policies, because these policies, we don't want policies that are for young people without young people. So when these policies are done, it reflects our our perspectives, and just brings what we need into the policies without having to have someone speak for us. So we speak for ourselves, and this only happens if we're well educated. We are aware about what it is that we want to talk about, and we are part of these workshops and seminars. We also have our own advocacy groups, as well as we just participate in some of the campaigns that are happening. We've had opportunities where we're supporting some of our friends in Malawi that are talking about these bills through social media. You're engaging in in these platforms. So having more of such platforms for young people, and resources that are readily available, and laws and policies that ensure that young people's creativity is put to work are really good.
Thank you very much, Trinavanti. I know there's a lot to talk about, but as you're mentioning, the most important thing, a very conducive policy and legislative environment that is supportive of the needs of adolescent girls and young women, or adolescents and and young people in their entirety. And I know there's a lot to talk about, from the approaches that can be used, to the advocacy, to the progress that has been made by some of the countries. But I would like to come back to all the panelists, and this just ask for your call to action as we wrap up. Unfortunately, due to time, we have to cut it short and wrap up here. But I would like to hear from you before we close. As we are commemorating International Safe Abortion Day, but also going beyond this day, as we continue in the region, what would be your call to action for the different sectors, as well as different stakeholders within our respective countries and within our SADC region. So I'll start with Honorable Esperon. Thank you.
Thank you, Shamed. Thank you, Shamed. I'll be brief. We need to establish and strengthen a coordinated network to link stakeholders and health system partners to advocate for safe abortion and improve access to comprehensive abortion care. Create and ensure communication and sensitization about the national legal framework and guidelines to safe abortion.
Thank you very much, Honorable Esperon. And I'll move on to Honorable Dr. Ngwale.
Yeah, thank you so much, Amen. There are two things that I want to talk about going forward. The first one is, whilst we are waiting for laws to be changed, there's lots of women dying, lots of women having complications, the figures say it. And here in Malawi, what we've been saying is, when you look at the data of mortality data on unsafe abortion, it is so clear that more women are dying in the rural areas than in the cities. The reason why is that there are institutions which I will not mention in the cities that provide a safe abortion. Government is aware that those institutions do provide safe abortion, but they turn away deliberately to allow things to happen the way they're happening. As a result, people in the cities, as women in the cities are saved, whilst women in the rural areas have nowhere to go. And these facilities that provide abortion services charge a fee, which is unaffordable for most rural women, but affordable for women in towns. Now, this anomaly is unacceptable. So we've been discussing with the civil society, NGOs, and Parliament that maybe we need to take these institutions that are providing safe abortion in towns to ask them to maybe to open selected places in rural areas as well, so that women in rural areas can have access. So that it has been well received by the NGOs. Of course, they are scared about the implications, but chances are that we are going to do something about that one. The second thing I want to talk about is SAfAIDS. We always talk about details, country details. For example, Seychelles tells us how it is there in Zimbabwe, will tell us how it is Zambia. But there's need for you as a secretariat to try and even out these things, lift the countries that have lagged behind, pull them up a little to match the next level. I would love to see that as an action going forward, because some of these things, people in Malawi, some of them, because they don't know what's happening elsewhere, they feel that we are right to have these restrictive laws. Maybe Trinavante can agree with me that the people in Malawi normally follow what is happening in Zambia. And the same is also true the other way. Our tribes, most of them are the same. Trinavante's name is a Malawian name. So what I'm saying is, when they hear that Zambia is doing this, most Malawians tend to say, then maybe we should also try and get that one. But then there's no effort at the moment for people to know what's happening in Zambia. When we attend these meetings, we only hear what is happening in Zambia. And I go back to Malawi to live in my atmosphere. But I'm looking at how can we get Zambians into Malawi to talk about what the SRHR in Zambia as of now. It may not succeed the first day, But if it happens several times, people will have a picture that maybe something's happening. I've liked what has been discussed today, the use of the social media for safe abortion, SRHR messages to the young people. I think that's a very good initiative that can be borrowed. And also, I think Bongi has mentioned about the use of lived experiences. We did try that here, and it did move many people. And I think indeed we can try to move our religious people by, bringing in lived experiences of women that have suffered a lot. So these are some of the things that I would love to see happen. Of course, we need to continue communicating with most members of parliament so that they are at the same level about this, because, for example, for the past 2-3 years, we have ignored them, of course, because of parliament itself. To asking the NGOs to do media messages first and civic education. But then at Parliament, no activity has happened over the past 2-3 years. So therefore, there's a lot of coldness that has come to Parliament regarding this issue. And therefore, there's need to empower maybe the NGOs to invite members of Parliament to continue the civic education, because now I can see we are getting there. And therefore, we need to start also talking to members of Parliament again, not necessarily to say change the laws, but issues of messages, issues of lived experiences. Members of Parliament also need that. And once we do that, I'm sure come next year, if I'm still a member of Parliament, come next year, I can see us changing the laws. Thank you so much, Amen.
Thank you very much, Honorable Dr. Ngwale, for those calls to action, but also elaborating even further, looking at what can work for Malawi and other countries within the region. Bongi, I'll come to you, your call to action.
Thank you very much, Charmaine and colleagues. Just to say that SRHR issues remain very sensitive within faith settings. And one of the biggest things that we need to continue to do is to use available entry points to get the message across. Use available entry points. A few years ago, we used HIV. We need to use that as an entry point to educate until we get more and more allies, and until religious leaders acknowledge the influence that they have and the platforms that they have, and how these can be used to dispel myths around SRHR issues. I think faith community platforms present a powerful opportunity to challenge stigma and promote health equity for adolescent girls and young women. And by educating and teaching our leaders how to approach these sensitive SRHR issues with empathy, from an informed position and with community support, they can play a crucial role. Help them understand that they can play a crucial role in ensuring that all individuals, everybody, all young girls and women are empowered to make informed choices about their reproductive health. And I think most importantly, Charmaine, it's to help them understand that doing this is a vital part of who they say they are. It's a vital part of their mission to care for the vulnerable and uphold the dignity of all people. Thank you.
Thank you very much, Bongi. And lastly, I'll come to you, Chinavante, your call to action.
Thank you so much, Charmaine. I think my call to action for this particular conversation would be for us to continue building and strengthening alliances with young people, especially adolescent girls and young women, CSOs, FBOs, as well as the community at large. This would help us, to continue creating safe spaces for young people, both online and physically, and also keep involving us in these platforms where, you know, we can continue to create awareness, we can continue to learn, as well as we can continue to, you know, empower ourselves where we can, you know, enable us, you know, have information and resources that would help us tackle certain needs that surround sexual reproductive health issues, as well as ensuring that we create sustainable change when it comes to, you know, when it comes to young people's policies, as well as addressing issues. So the issues shouldn't be half solved. It should, you know, the change to the particular, be it policies, be it laws, should continue, you know, should be very sustainable, that they don't, you know, you know, harm young people later, or other young people have challenges because of some of the policies that we are creating right now. So having to create sustainable change, that would go to action. Thank you.
Thank you very much, Shinavante, and I would like to thank you all, our esteemed panelists, you know, for sharing with us your expertise, but also your insights from your sector, but going beyond that and calling us all to action, to come together as a unified front, to uphold and keep going, you know, with the bold and united efforts to ensure that we are safeguarding the health, the well-being, but most importantly, the dignity and the lives of adolescent girls and young women. Would like to thank you today for taking time out to be with us today to discuss this, but also applaud you for the efforts that you have currently underway in your respective countries, not only as we commemorate International Safe Abortion Day, but every other day, to ensure that, you know, the lives of adolescent girls and young women are made better, and that they are able to access equitable and conducive sexual and reproductive health services, including safe abortion services. And I believe that together we can make significant strides in ensuring that adolescent girls and young women across the SADC region have a right to safe, legal, accessible abortion services. You know, let's all stay bold and united in our advocacy for a better world, a better future for adolescent girls and young women in our region. Thank you all for joining us today. This has been the regional #SupportChoice Commitment to Action Policy Advocacy Roundtable, being commemorated under the SAfAIDS flagship My Choice, Our Choice campaign as part of International Safe Abortion Day. Thank you all for joining us today. Wishing you a pleasant day. Thank you.